NURS-6501. Week 6 Midterm Exam NURS-6501N Advanced Pathophysiology. Question 1. Why is an increased influx of calcium into an injured cell problematic in ischemia reperfusion injury? A. It prevents the recruitment of inflammatory cells. B. It causes excessive muscle contractions. C. It enhances the efficiency of ADP production in mitochondria. D. It triggers cell death. The correct answer is D. It triggers cell death. Question 2. Following the formation of a platelet plug, which event is crucial for continuing the vascular repair process after endothelial injury? A. Constriction of the vessel wall to reduce blood flow. B. Endothelial cells beginning to proliferate and repair the vessel lining. C. Release of inflammatory mediators from activated platelets. D. Synthesis of new extracellular matrix components by fibroblasts. The correct answer is B. Endothelial cells beginning to proliferate and repair the vessel lining. Question 3. A patient with a history of chronic obstructive pulmonary disease presents to the emergency department with increased shortness of breath and cyanosis. Arterial blood gas analysis reveals low oxygen levels. This patient's cells are at risk of injury due to which of the following mechanisms? A. Physical injury. B. Infection. C. Hypoxia. D. Immune response. The correct answer is C. Hypoxia. Question 4. Where is antidiuretic hormone produced? A. Adrenal gland. B. The mid-portion of the pituitary gland. C. Posterior pituitary gland. D. Anterior pituitary gland. The correct answer is C. Posterior pituitary gland. Question 5. In pulmonary hypertension, which of the following alterations in the pulmonary arteries is not typically anticipated? A. Fibrosis of the intima. B. Arteriosclerosis. C. Dilatation of the arteries. D. Medial hypertrophy. The correct answer is C. Dilatation of the arteries. Question 6. A young female patient presents with jaundice and laboratory tests reveal an elevated respiratory count, low haptoglobin, and high lactate dehydrogenase levels indicating hemolysis. Which form of bilirubin is most likely to be elevated in this patient? A. Direct bilirubin. B. Indirect bilirubin. C. Indirect bilirubin. D. Direct bilirubin. The correct answer is C. Indirect bilirubin. Question 7. A ventricular septal defect with blood flow from the left ventricle to the right ventricle is an example of which type of cardiac pathology? A. Flow obstruction. B. Regurgitant flow. C. Shunted flow. D. Pump failure. The correct answer is C. Shunted flow. Question 8. During an assessment of coronary artery disease severity using cardiac catheterization, a patient is found to have a significant stenosis in the proximal left anterior descending artery. At what percentage of luminal narrowing is the stenosis typically considered to be critical? A. 60% luminal stenosis. B. 50% luminal stenosis. C. 70% luminal stenosis. D. 80% luminal stenosis. The correct answer is C. 70% luminal stenosis. Question 9. In a suspected case of ARDS, a patient's chest X-ray reveals diffuse bilateral infiltrates. The healthcare team is considering non-cardiogenic pulmonary edema secondary to ARDS as the likely diagnosis. What is the primary effect of this type of pulmonary edema on lung function? A. It increases the airway resistance due to secretion buildup. B. It reduces lung compliance, making the lungs stiffer. C. It improves lung elasticity, increasing inspiratory capacity. D. Diminishes surface tension, promoting atelectasis. The correct answer is B. It reduces lung compliance, making the lungs stiffer. Question 10. Which of the following best describes the pathophysiological mechanism of secondary hyperparathyroidism due to chronic kidney disease? A. Decreased parathyroid hormone secretion leading to hypercalcemia. B. Decreased renal activation of vitamin D leading to hypocalcemia and hyperphosphatemia. C. Increased renal phosphate excretion leading to hypophosphatemia. D. Increased calcium absorption in the gastrointestinal tract leading to hypercalcemia. The correct answer is B. Decreased renal activation of vitamin D leading to hypocalcemia and hyperphosphatemia. Question 11. What clinical significance does the term pulmonary shunt hold in the context of acute respiratory distress syndrome? A. It indicates the inability to improve hypoxemia with oxygen therapy. B. It refers to altered lung compliance. C. It signifies protein-poor exudate in the lung interstitium. D. It suggests a cardiac type of damage to the lung. The correct answer is A. It indicates the inability to improve hypoxemia with oxygen therapy. Question 12. Which statement correctly describes the onset of calcific aortic stenosis in individuals with bicuspid versus tricuspid aortic valves? A. Patients with bicuspid aortic valves tend to develop calcific aortic stenosis at a younger age. B. There is no difference in the age of onset of calcific aortic stenosis between bicuspid and tricuspid aortic valve patients. C. The onset of calcific aortic stenosis is generally delayed in patients with bicuspid aortic valves. D. Calcific aortic stenosis typically presents earlier in life in patients with tricuspid aortic valves. The correct answer is A. Patients with bicuspid aortic valves tend to develop calcific aortic stenosis at a younger age. Question 13. Which of the following statements is accurate regarding asthma? A. Asthma is a reversible obstructive lung disease. B. Asthma primarily affects individuals over 40 years of age. C. Viruses are uncommon triggers of asthma attacks. D. Asthma predominantly involves the large airways. The correct answer is A. Asthma is a reversible obstructive lung disease. Question 14. What is the result of increased intraglomerular capillary pressure in chronic kidney disease? A. Faster filtration rate of plasma. B. Stabilization of kidney function. C. Accelerated sclerosis of the remaining nephrons. D. Enhanced nephron regeneration. The correct answer is C. Accelerated sclerosis of the remaining nephrons. Question 15. A patient with normal renal function suddenly experiences an increase in systemic blood pressure. Which intrinsic mechanism is most likely to occur to maintain a constant glomerular filtration rate? A. Tubuloglomerular feedback, resulting in increased sodium reabsorption in the distal tubule. B. Tubuloglomerular feedback leading to efferent arteriole constriction. C. Tubuloglomerular feedback leading to dilation of the afferent arteriole. D. Tubuloglomerular feedback leading to afferent arteriole constriction. The correct answer is D. Tubuloglomerular feedback leading to afferent arteriole constriction. Question 16. A patient is brought to the clinic by their spouse, who reports that for several months they have noticed the patient experiencing daytime sleepiness and fatigue. The nurse practitioner is concerned about obstructive sleep apnea. Which of the following would be diagnostically helpful for the nurse practitioner to inquire about from the spouse? A. Does your husband get out of breath when he walks short distances? B. Does your husband have food allergies? C. Does your husband get chest pain during physical exertion? D. Does your husband snore? The correct answer is D. Does your husband snore? Question 17. Insulin resistance in type 2 diabetes mellitus impacts glucose metabolism by A. Increasing glucose uptake by cells. B. Enhancing insulin receptor sensitivity. C. Reducing glucose uptake by muscle and fat cells. D. Decreasing hepatic glucose production. The correct answer is C. Reducing glucose uptake by muscle and fat cells. Question 18. A patient with asthma experiences a sudden, severe exacerbation. Which of the following pathophysiological processes is most likely responsible for the acute presentation? A. Decreased lung compliance due to fibrosis. B. Fluid accumulation in the alveoli secondary to heart failure. C. Hyperinflation of alveoli due to air trapping and bronchospasm. D. Reduced mucus production and decreased airway resistance. The correct answer is C. Hyperinflation of alveoli due to air trapping and bronchospasm. Question 19. Which hormone is primarily involved in regulating appetite and is often found at higher levels in individuals with obesity? A. Cortisol. B. Leptin. C. Ghrelin. D. Insulin. The correct answer is B. Leptin. Question 20. When evaluating potential causes of varicose veins, which of the following would not be considered an intrinsic factor? A. Musculovenous pump. B. Sympathetic tone. C. Valve integrity. D. Gravity. The correct answer is D. Gravity. Question 21. A female patient is in her third trimester of pregnancy. The observed increase in uterine size is primarily due to A. Hyperplasia of the uterine smooth muscle cells. B. Atrophy of the uterine epithelial lining. C. Hypertrophy of the uterine smooth muscle cells. D. Metaplasia of the uterine epithelial lining. The correct answer is C. Hypertrophy of the uterine smooth muscle cells. Question 22. Which endocrine disorder is associated with decreased bone resorption and consequent thickening of the bone? A. Cushing's syndrome. B. Hyperthyroidism. C. Diabetes mellitus. D. Hypoparathyroidism. The correct answer is D. Hypoparathyroidism. Question 23. Which histological layer of the blood vessels is correctly matched with its primary component? A. Basal membrane, adipose tissue. B. Adventitia, simple squamous epithelium. C. Intima, stratified squamous epithelium. D. Media, smooth muscle cells. The correct answer is D. Media, smooth muscle cells. Question 24. In the context of pyelonephritis, scarring is often seen in a pyramidal shape within the renal parenchyma. What anatomical structure corresponds to this pattern of scarring? A. Nephron. B. Renal pelvis. C. Renal capsule. D. Renal papilla. The correct answer is D. Renal papilla. Question 25. A patient with normal renal function experiences a sudden decrease in the flow through the renal tubules. Which response will occur to normalize glomerular filtration rate? A. Increased renin release leading to efferent arteriole constriction. B. Increased renin release leading to afferent arteriole dilation. C. Decreased renin release leading to afferent arteriole constriction. D. Decreased renin release leading to efferent arteriole dilation. The correct answer is A. Increased renin release leading to efferent arteriole constriction. Question 26. An adult patient with a history of chronic hepatitis C presents with a sudden onset of dark urine and lower extremity rash. A biopsy of the rash reveals deposits of immune complexes in small blood vessels. Which of the following best describes the primary response that results in tissue damage in this patient's condition? A. Direct cytolysis by cytotoxic T cells. B. Activation of the complement cascade causing local inflammation. C. Direct cytolysis by the immune complexes. D. Hyperactivation of natural killer cells leading to vascular injury. The correct answer is B. Activation of the complement cascade causing local inflammation. Question 27. When discussing the prognosis of aortic stenosis with a patient, which three clinical manifestations are traditionally mentioned as indicators of poor prognosis? A. Cough, hemoptysis, and nocturia. B. Palpitations, chest pain, and fatigue. C. Stroke, syncope, and fatigue. D. Angina, syncope, and heart failure. The correct answer is D. Angina, syncope, and heart failure. Question 28. An older adult patient presents with a 10-year history of chronic cough and sputum production, particularly in the mornings. She has smoked 1 pack of cigarettes daily for 45 years, but quit last year. Spirometry indicates a post-bronchodilator FEV1 FVC ratio of 0.65. Which of the following pathophysiological processes is most directly responsible for the excessive mucus production observed in this condition? A. Accumulation of inflammatory cells in the alveoli. B. Thickening of the arterial walls in the pulmonary circulation. C. Decreased cilia function in the bronchi. D. Hyperplasia of the mucus-secreting glands in the bronchioles. The correct answer is D. Hyperplasia of the mucus-secreting glands in the bronchioles. Question 29. A patient undergoes an experimental treatment with a new medication. After several weeks, their disease improves, but they develop a persistent dry cough. Previous animal models did not identify the side effect of the medication. This situation highlights the importance of understanding A. The in vitro effects of medications. B. The nocebo effect of medications. C. The placebo effect of medications. D. The in vivo effects of medications. The correct answer is D. The in vivo effects of medications. Question 30. A child patient presents with a 12-hour history of progressively worsening abdominal pain, now localized to the right lower quadrant, accompanied by nausea. On physical examination, the patient exhibits rebound tenderness at McBurney's point. Which of the following is the most likely etiology for their condition? A. Lymphoid hyperplasia. B. Carcinoid tumor. C. Fecaliths. D. Calculi. The most likely etiology for this patient's condition is C. Fecaliths. Question 31. A 35-year-old female patient presents with paresthesias in her extremities, muscle cramps, and facial twitching. Her medical history includes a recent thyroidectomy due to papillary thyroid carcinoma. Lab test reveals a low serum calcium level. What is the most likely cause of the hypocalcemia? A. Vitamin D deficiency due to reduced sun exposure. B. Chronic malabsorption syndrome affecting calcium uptake. C. Hypoparathyroidism secondary to accidental damage or removal of parathyroid glands during thyroidectomy. D. Renal failure leading to decreased calcium reabsorption. Correct answer is C. Hypoparathyroidism secondary to accidental damage or removal of parathyroid glands during thyroidectomy. Question 32. Which of the following statements about living cells is accurate? A. The cell is a dynamic structure. B. The cell is a static structure. C. The cell does not interact with its environment. D. The cell lacks organization. The correct answer is A. The cell is a dynamic structure. Question 33. Which of the following is not characteristic of asthma? A. Inflammation of the small airways. B. Reversible bronchospasm. C. Mucus production. D. Productive cough for 3 months per year. The correct answer is D. Productive cough for 3 months per year. Question 34. What is the primary reason for the occurrence of embolic complications in a patient with infective endocarditis? A. Dislodgement of valvular vegetations. B. Rupture of chordae tendineae. C. Calcification of the valve leaflets. D. Erosion of the valve cusps. The correct answer is A. Dislodgement of valvular vegetations. Question 35. The nurse practitioner recognizes that adult patients may present with signs and symptoms of type 1 diabetes in which conditions? A. Destruction of insulin-producing beta cells. B. Diminished glucagon levels. C. Development of insulin resistance. D. Disruptions in secreting critical digestive enzymes. The correct answer is destruction of insulin-producing beta cells. Question 36. Which of the following correctly pairs a gross anatomical structure from the bronchial tree with its corresponding normal microscopic tissue type? A. Alveoli, simple squamous epithelium. B. Main bronchi, specialized cartilage lining the lumen. C. Trachea, non-ciliated columnar epithelium. D. Bronchioles, stratified squamous epithelium. The correct answer is A. Alveoli, simple squamous epithelium. Question 37. What is the role of cytochrome C in cellular injury? A. Cytochrome C promotes the production of reactive oxygen species. B. Cytochrome C is released into the cytoplasm to enhance cellular repair mechanisms. C. Cytochrome C promotes apoptosome formation and apoptosis. D. Cytochrome C interacts with mitochondrial DNA to mitigate damage during injury. The correct answer is C. Cytochrome C promotes apoptosome formation and apoptosis. Question 38. How do endocrine and metabolic pathways disrupted in obesity contribute to the development of type 2 diabetes mellitus? A. By increasing insulin secretion from the pancreas. B. By decreasing glucagon production. C. By enhancing the body's sensitivity to insulin. D. By causing insulin resistance and impairing glucose uptake. The correct answer is D. By causing insulin resistance and impairing glucose uptake. Question 39. An elderly patient with a history of hypertension presents with shortness of breath and fatigue on exertion. An echocardiogram shows a thickened aortic valve with decreased leaflet mobility. Which molecular event is predominantly responsible for the cellular changes observed in the affected tissue? A. Upregulation of proteoglycan synthesis. B. Enhanced production of anti-inflammatory cytokines. C. Activation of osteogenic signaling pathways. D. Inhibition of osteoblast differentiation. The correct answer is C. Activation of osteogenic signaling pathways. Question 40. Which one of the following is associated with type 2 but not type 1 diabetes? A. Diabetic ketoacidosis. B. Acne. C. Polyuria. D. Hyperosmolar hyperglycemic syndrome. The correct answer is D. Hyperosmolar hyperglycemic syndrome. Question 41. Which condition can individuals with type 2 diabetes develop that is typically not seen in those with type 1 diabetes? A. Chronic insulin deficiency from birth. B. Insulin-dependent diabetes mellitus. C. Hyperosmolar hyperglycemic syndrome. D. Autoimmune destruction of pancreatic beta cells. The correct answer is C. Hyperosmolar hyperglycemic syndrome. Question 42. An adult patient with a history of multiple episodes of acute pancreatitis and alcohol use disorder presents with recent recurrent episodes of abdominal pain, new onset diabetes, and steatorrhea. Which pathological process occurring in the pancreas is most likely causing these manifestations? A. Hereditary pancreatic enzyme deficiency leading to a loss of exocrine function. B. Chronic pancreatic ductal obstruction leading to a loss of endocrine and exocrine function. C. Targeted autoimmune destruction of islet cells leading to a loss of endocrine function. D. Progressive pancreatic inflammation and fibrosis leading to loss of exocrine and endocrine function. The correct answer is D. Progressive pancreatic inflammation and fibrosis leading to loss of exocrine and endocrine function. Question 43. A middle-aged former coal miner presents with worsening shortness of breath and a history of prolonged exposure to coal dust in the workplace. What is a common characteristic seen in individuals with this work history? A. Bronchodilation. B. Heightened production of mucus by the bronchi. C. Stiffening of the lung tissue and decreased lung compliance. D. Occasional enhancement of lung function. The correct answer is C. Stiffening of the lung tissue and decreased lung compliance. Question 44. During rapid deceleration trauma, such as from a vehicular collision, where is an aortic dissection most likely to occur? A. Curvature of the aortic arch near the common carotid arteries. B. Inferior abdominal aorta above the aortic bifurcation. C. Descending thoracic aorta adjacent to the ligamentum arteriosum. D. Proximal ascending aorta near the aortic root. The correct answer is C. Descending thoracic aorta adjacent to the ligamentum arteriosum. Question 45. If an elastic band were to constrict the ascending aorta by 50%, which of the following would not be an anticipated response? A. The cardiac muscle would synthesize more protein. B. The thickness of the cardiac muscle would increase. C. The volume of blood ejected with each heartbeat would increase. D. The heart would react similarly to how it does in cases of hypertension. The correct answer is C. The volume of blood ejected with each heartbeat would increase. Question 46. What is the anticipated outcome in a patient with long-standing pulmonary hypertension? A. Aggravation of asthma. B. Pulmonary infarctions. C. COR pulmonale. D. Liver failure. The correct answer is C. COR pulmonale. Question 47. Which of the following findings is an example of cardiac remodeling that occurs in response to chronic heart failure? A. Temporary increase in heart rate. B. Progressive ventricular dilation and myocardial hypertrophy. C. Reversible reduction in ejection fraction. D. Transient hypertrophy of the right ventricle. The correct answer is B. Progressive ventricular dilation and myocardial hypertrophy. Question 48. An adult patient arrives at the emergency department with widespread hives, difficulty breathing, and a sensation of throat tightening minutes after eating a shrimp cocktail. Vital signs show a blood pressure of 80-60 millimeters of mercury, heart rate of 128 beats per minute, and respiratory rate of 25 breaths per minute. Which immunoglobulin is most likely mediating this patient's condition? A. IgA, B. IgM, C. IgA, D. IgG. The correct answer is C. IgA. Question 49. In the context of type 1 diabetes, what does a low level of C-peptide in the blood typically indicate? A. The body is effectively using insulin. B. Low or absent insulin production by the body. C. Normal blood glucose levels. D. Efficient glucose metabolism. The correct answer is B. Low or absent insulin production by the body. Question 50. Autophagy serves a variety of cellular functions, but is not responsible for which of the following? A. Normal cell turnover. B. Normal cell metabolism. C. Protein synthesis. D. Tissue atrophy. The correct answer is C. Protein synthesis. Hello, everyone. Today we are going to do NURS-6501N, Advanced Pathophysiology Midterm Exam. NURS-6501N, Advanced Pathophysiology, is one of Walden's University MSN courses. I will provide the answers to all 100 questions without providing explanations, but I will make videos with explanations in the future. If you have any course that you would like me to help you with, just reach out to me via my email. Let's get started with the exam. Question 51. Oxygen depletion soon leads to cellular swelling because of A. Decreased sodium potassium ATPase activity. B. Increased mitochondrial ADP production. C. Elevated potassium influx. D. Enhanced protein synthesis. The correct answer is A. Decreased sodium potassium ATPase activity. Question 52. Which of the following etiologies is most commonly associated with aortic dissection in the general population? A. Syphilis. B. Marfan syndrome. C. Trauma. D. Hypertension. The correct answer is D. Hypertension. Question 53. What is the primary objective of a cell in maintaining homeostasis? A. To enhance waste production and facilitate detoxification. B. To maintain viability and integrity of function. C. To promote DNA mutation and protect genetic material. D. To increase cellular reproduction rate and support growth. The correct answer is B. To maintain viability and integrity of function. Question 54. What effect occurs when blood flow is reestablished in tissues that have suffered a partial injury? A. Oxygen consumption by the tissue decreases. B. Cellular glucose uptake decreases. C. Intracellular potassium is expelled. D. Extracellular calcium enters the cell. The correct answer is D. Extracellular calcium enters the cell. Question 55. Patients with obesity hypoventilation syndrome should be investigated for A. Allergic rhinitis. B. Pulmonary hypertension. C. Blood disorders. D. Asthma. The correct answer is B. Pulmonary hypertension. Question 56. In the renal system, when there is a reduction in urine flow through the tubules, what is the initial event that initiates a series of processes aimed at increasing tubular flow by elevating the glomerular filtration rate? A. Dilation of the efferent arterioles in the kidneys. B. Aldosterone release by the adrenal gland. C. Adenosine release by the macula densa. D. Decreased delivery of NaCl to the macula densa. The correct answer is D. Decreased delivery of NaCl to the macula densa. Question 57. Which of the following findings is not typical for chronic bronchitis? A. Secondary polycythemia. B. No significant VQ mismatch. C. Wheezing on lung exam. D. Hypercapnia and hypoxemia. The correct answer is B. No significant VQ mismatch. Question 58. A middle-aged adult with a 32-pack-year smoking history presents with shortness of breath, with episodes of wheezing, which has become worse in the past few months. A chest X-ray reveals hyperinflation of the lungs and flattened diaphragms. If a biopsy were taken of the patient's lungs, what changes would most likely be observed under the microscope? A. Hyperplasia of goblet cells within the bronchial walls. B. Thickening of the alveolar capillary membranes. C. A decreased number of septae between alveolar spaces. D. Extensive fibrosis throughout the lung parenchyma. The correct answer is A. Hyperplasia of goblet cells within the bronchial walls. Question 59. A young adult female patient presents with dysuria, frequency, and urgency. She has no significant medical history and is not pregnant. Which one of the following organisms is the most common cause of her symptoms? A. Proteus mirabilis. B. Escherichia coli. C. Staphylococcus saprophyticus. D. Klebsiella pneumoniae. The correct answer is B. Escherichia coli. Question 60. A patient presents with sudden chest pain, diaphoresis, and nausea. ECG shows ST segment elevations consistent with inferior wall damage. Which coronary artery is most likely occluded in this patient? A. Left anterior descending artery. B. right coronary artery. C, left main coronary artery. D, left circumflex artery. The correct answer is B, right coronary artery. Question 62. A prolonged state of hypoxia in a patient's cells will eventually lead to which of the following? A, decreased intracellular calcium. B, increased protein synthesis. C, detachment of ribosomes. D, decreased phospholipid accumulation. The correct answer is C, detachment of ribosomes. Question 63. A middle-aged adult patient, a former smoker with a history of recurrent respiratory infections, presents with a chronic cough and increased sputum production. The patient reports multiple episodes of pneumonia over the past few years. On physical examination, coarse crackles are heard on lung auscultation. Chest imaging reveals dilated bronchi with thickened walls and mucus plugging. Which of the following is the correct sequence of events that led to this condition? A, infection, inflammation, obstruction, bronchodilation. B, obstruction, bronchodilation. C, bronchospasm, inflammation, bronchoconstriction, bronchodilation. D, inflammation, infection, atrophy, fibrosis, bronchodilation. The correct answer is D, inflammation, infection, atrophy, fibrosis, bronchodilation. Question 64. What is the predominant type of T cell implicated in the pathogenesis of Crohn's disease? A, helper T cells. B, cytotoxic T cells. C, regulatory T cells. D, helper T cells. The correct answer is D, helper T cells. Question 65. An elder adult female patient with a 40-year history of smoking presents to the clinic with complaints of progressive shortness of breath over the past several years. She notes that her breathlessness is most pronounced when climbing stairs or carrying groceries. She denies any chest pain, chronic cough, or significant sputum production. Physical examination reveals a barrel chest and decreased breath sounds with prolonged expiration. Pulmonary function tests are ordered. Considering the likely diagnosis, what would be the most likely finding on the diffusing capacity of the lungs for a carbon monoxide test? A, decreased DLCO due to loss of alveolar surface area. B, increased DLCO due to compensatory erythrocytosis. C, normal DLCO as it is not affected in emphysema. D, variable DLCO based on the time of day the test is performed. The correct answer is A, decreased DLCO due to loss of alveolar surface area. Question 66. An adult patient is being evaluated for secondary causes of hypertension due to resistant blood pressure and an onset of high blood pressure at an earlier age. He reports no family history of hypertension. Which of the following mechanisms can cause secondary hypertension? A, increase in parathyroid hormone. B, decreased release of natriuretic peptides. C, elevated aldosterone levels. D, increased secretion of insulin. The correct answer is C, elevated aldosterone levels. Question 67. An adult man presents with excessive daytime sleepiness. His wife reports that he snores loudly every night. The patient's BMI is 32 kilograms, M2. He denies any history of smoking or alcohol consumption. Which of the following pathophysiologic mechanisms is the primary factor contributing to his likely diagnosis? A, increased pharyngeal tissue mass leading to partial or complete airway obstruction. B, decreased diaphragmatic excursion leading to reduced inspiratory volume. C, absence of neural input leading to cessation of respiratory effort. D, parasympathetic overactivity leading to bronchoconstriction. The correct answer is A, increased pharyngeal tissue mass leading to partial or complete airway obstruction. Question 68. A nurse practitioner is reviewing the effects of angiotensin II as part of the pathophysiology of hypertension. Which of the following effects is not directly attributed to angiotensin II? A, enhancement of antidiuretic hormone secretion. B, promotion of sodium, chloride, and water secretion in renal tubules. C, upregulation of sympathetic nervous system activity. D, increased release of aldosterone from the adrenal cortex. The correct answer is B, promotion of sodium, chloride, and water secretion in renal tubules. Question 69. A patient with chronic gastritis develops vitamin B12 deficiency. Which of the following best explains this association? A. Gastritis causes decreased absorption of vitamin B12 in the duodenum. B. Gastritis increases secretion of hydrochloric acid, which destroys vitamin B12. C. Gastritis causes direct malabsorption of all vitamins. D. Gastritis leads to loss of parietal cells, reducing intrinsic factor production necessary for vitamin B12 absorption. The correct answer is D. Gastritis leads to loss of parietal cells, reducing intrinsic factor production necessary for vitamin B12 absorption. Question 70. Which of the following mechanisms contributes to the progression of chronic kidney disease? A. Overactivity of the renin-angiotensin-aldosterone system. B. Upregulation of parathyroid hormone secretion. C. Excessive secretion of antidiuretic hormone. D. Inadequate erythropoietin production. The correct answer is A. Overactivity of the renin-angiotensin-aldosterone system. Question 71. What genetic process is likely responsible for the occurrence of asthma in only one of a pair of identical twins? A. Transgenerational inheritance. B. Epigenetic modification. C. Genomic imprinting. D. Methylation. The correct answer is B. Epigenetic modification. Question 72. A patient with diverticulosis presents with brisk, bright red bleeding per rectum. The patient denies any abdominal pain. Which term accurately describes this presentation, and where is the most likely source of the bleeding? A. Hematochezia, lower gastrointestinal tract. B. Melena, upper gastrointestinal tract. C. Hematochezia, upper gastrointestinal tract. D. Melena, lower gastrointestinal tract. The correct answer is A. Hematochezia, lower gastrointestinal tract. Question 73. Vitamin D deficiency contributes to secondary hyperparathyroidism primarily through A. Increased calcium absorption in the gastrointestinal tract. B. Increased activation of vitamin D in the kidneys. C. Reduced intestinal absorption of calcium leading to hypocalcemia. D. Decreased renal reabsorption of phosphate. The correct answer is C. Reduced intestinal absorption of calcium leading to hypocalcemia. Question 74. In immune checkpoint myocarditis, a rare but serious complication of cancer immunotherapy, the use of drugs that inhibit CTLA-4 and PD-1 pathways can lead to unintended cardiac effects. What is the primary mechanism by which these drugs contribute to the development of myocarditis? A. They stimulate excessive sympathetic nervous system activity, leading to cardiomyocyte apoptosis. B. They promote an uncontrolled autoimmune response against myocardial antigens. C. They directly induce cytotoxic effects on cardiomyocytes, leading to necrosis. D. They decrease myocardial blood flow by inducing coronary artery vasoconstriction. The correct answer is B. They promote an uncontrolled autoimmune response against myocardial antigens. Question 75. A patient is diagnosed with secondary hypertension. This indicates that the high blood pressure is A. Attributable to a specific cause, such as renal disease or an endocrine disorder. B. A result of essential hypertension further complicated by lifestyle factors. C. Due to an underlying condition affecting organs or tissues other than the heart and kidneys. D. The most common form of hypertension with no identifiable cause. The correct answer is A. Attributable to a specific cause, such as renal disease or an endocrine disorder. Question 76. A microscopic analysis of an atherosclerotic plaque most likely reveals which of the following components as the central core? A. Intact endothelial cells and collagen. B. Platelets and fibrin. C. Smooth muscle cells and elastic fibers. D. Necrotic cellular debris and cholesterol crystals. The correct answer is D. Necrotic cellular debris and cholesterol crystals. Question 77. Which of the following is not typically caused by a large pituitary tumor? A. Bitemporal hemianopsia. B. increased red blood cell production. C. Panhypopiturism. D. Seizures. The correct answer is B. Increased red blood cell production. Question 78. In anti-endothelial cell antibody-mediated vasculitis, thrombus formation often complicates the clinical picture. What is the primary mechanism by which antibodies contribute to this process? A. They contribute to damage to vascular endothelial cells. B. They promote platelet aggregation by directly activating platelets. C. They decrease clotting factor synthesis. D. They enhance breakdown of clotting factors. The correct answer is A. They contribute to damage to vascular endothelial cells. Question 79. A patient's echocardiography demonstrates a significantly narrowed aortic valve orifice with left ventricular hypertrophy. Which major category of cardiac pathology best explains this condition? A. Flow obstruction. B. Shunted flow. C. Pump failure. D. Regurgitant flow. The correct answer is A. Flow obstruction. Question 80. A 28-year-old female presents with chronic diarrhea, steatorrhea, and anemia. She is diagnosed with celiac disease. Which of the following is the primary immunological mechanism leading to villus atrophy in celiac disease? A. IgE-mediated allergic reaction to gluten. B. Complement activation due to IgM deposits in the duodenum. C. T-cell-mediated immune response to gluten. D. Autoantibody production against parietal cells. The correct answer is C. T-cell-mediated immune response to gluten. Question 81. Which type of cell adaptation occurs when normal columnar ciliated epithelial cells of the bronchial lining have been replaced by stratified squamous epithelial cells? A. Anaplasia. B. Hyperplasia. C. Metaplasia. D. Dysplasia. The correct answer is C. Metaplasia. Question 82. A patient receiving chemotherapy for breast cancer develops nausea, vomiting, and jaundice. The nurse practitioner suspects that the chemotherapy drugs might be causing liver toxicity. This is an example of cell injury. Due to which of the following mechanisms? A. Immune response. B. Aging. C. Chemical injury. D. Hypoxia. The correct answer is C. Chemical injury. Question 83. In Crohn's disease, granulomas are present in the gastrointestinal tract. This feature distinguishes Crohn's from ulcerative colitis. What is the underlying pathophysiological mechanism responsible for granuloma formation? A. Eosinophilic infiltration due to parasitic infection. B. B-cell proliferation causing lymphoid hyperplasia. C. Overexpression of IL-10 leading to an anti-inflammatory response. D. Th1-mediated chronic inflammation with macrophage activation. The correct answer is D. Th1-mediated chronic inflammation with macrophage activation. Question 84. An elderly patient with a history of atrial fibrillation presents with sudden onset of right-sided weakness and aphasia. Which is the most likely source of the embolus causing this patient's symptoms? A. Carotid artery atherosclerotic plaque. B. Cardiac thrombus from the left atrium. C. Thrombus from a deep vein thrombosis. D. Right ventricular thrombus post-myocardial infarction. The correct answer is B. Cardiac thrombus from the left atrium. Question 85. Central diabetes insipidus is caused by which of the following? A. Inadequate production of antidiuretic hormone by the pituitary gland. B. Reduced filtration rate in the kidneys. C. High levels of cortisol secreted by the adrenal glands. D. Excessive production of insulin by the pancreas. The correct answer is A. Inadequate production of antidiuretic hormone by the pituitary gland. Question 86. In restrictive lung diseases such as pulmonary fibrosis, the primary pathophysiological change is A. Increased lung compliance and ease of lung expansion. B. Loss of lung elasticity, leading to reduced lung volume and impaired gas exchange. C. Airway obstruction caused by mucus plugs. D. Increased bronchial constriction and airway reactivity. The correct answer is B. Loss of lung elasticity, leading to reduced lung volume and impaired gas exchange. Question 87. A patient with ARDS is on mechanical ventilation but continues to have poor oxygenation. Which of the following explains why increasing the oxygen concentration might fail to improve the patient's POW2? A. Excessive airway secretions blocking oxygen delivery. B. Pulmonary shunting and alveolar collapse despite ventilation. C. Decreased production of surfactant leading to alveolar collapse. D. Hyperinflation of the lungs preventing adequate gas exchange. The correct answer is B. Pulmonary shunting and alveolar collapse despite ventilation. Question 88. What is a common initiating factor in the development of chronic kidney disease? A. High protein diet. B. Sedentary lifestyle. C. Diabetes or hypertension. D. Excessive fluid intake. The correct answer is C. Diabetes or hypertension. Question 89. How do diabetes mellitus and hypertension primarily affect renal blood vessels long term? A. Afferent arteriole dilation. B. Hyaline arteriosclerosis. C. Efferent arteriole dilation. D. Hyaline atherosclerosis. The correct answer is B. Hyaline arteriosclerosis. Question 90. When blood flow is restored after a period of ischemia, there is increased recruitment of inflammatory cells. How do these cells contribute to ischemia reperfusion injury? A. By promoting an influx of calcium into damaged cells. B. By increasing the production of anticoagulant factors. C. Through generation of reactive oxygen species. D. They enhance tissue regeneration and repair. The correct answer is C. Through generation of reactive oxygen species. Question 91. A patient is admitted to the hospital with severe sepsis secondary to bacterial pneumonia. Which of the following types of cell death is most likely to be associated with this patient's condition? A. Necrosis. B. Apoptosis. C. Autophagy. D. Pyroptosis. The correct answer is A. Necrosis. Question 92. A middle-aged construction worker has spent the last 25 years using a jackhammer to cut up sidewalks, but has consistently refused to wear protective equipment. He now presents with worsening shortness of breath, and a chest X-ray reveals diffuse fibrosis in his lung tissue. What type of lung disease would be anticipated by pulmonary function testing in this case? A. Restrictive lung disease. B. Asthma-like lung disease. C. Obstructive lung disease. D. No lung disease would be detectable by PFT. The correct answer is A. Restrictive lung disease. Question 93. Which immunosuppressive medication is commonly utilized to prevent rejection after organ transplantation and operates primarily through the inhibition of the mTOR pathway, which is instrumental in regulating the transcription and translation of autophagy-related genes? A. Cyclosporin. B. Mycophenolate mofetil. C. Azathioprine. D. Rapamycin. The correct answer is D. Rapamycin. Question 94. Which of the following statements accurately describes the pathophysiology of chronic kidney disease? A. Dietary factors are the main determinants in the progression and severity of chronic kidney disease. B. The progression of chronic kidney disease is only minimally related to blood pressure control and does not typically involve any shared pathological pathways. C. Irrespective of the initial cause or disease, the final common pathway leading to progressive CKD involves a shared mechanism. D. Chronic kidney disease primarily results from a single, specific cause that is consistent across all patients. The correct answer is C. Irrespective of the initial cause or disease, the final common pathway leading to progressive CKD involves a shared mechanism. Question 95. Which of the following statements accurately describes normal thyroid physiology? A. T4 measurement is the best single test for thyroid function. B. 80% of T3 is iodinated in the liver and kidney to become T4. C. TSH is typically elevated in hyperthyroidism. D. T4 is 20 times more abundant than T3. The correct answer is D. T4 is 20 times more abundant than T3. Question 96. A patient with a history of cirrhosis presents with ecchymosis. Laboratory tests reveal prolonged prothrombin time and normal platelet count. What does the elevated PT most likely indicate in this patient? A. Vitamin K deficiency secondary to malabsorption. B. Impaired hepatic synthesis of coagulation factors. C. Increased hepatic synthesis of proteins C and S. D. Platelet dysfunction despite normal platelet count. The correct answer is B. Impaired hepatic synthesis of coagulation factors. Question 97. The mucosal damage observed in celiac disease is primarily the result of A. Cell-mediated immune response to deamidated gliadin peptides. B. Complement system activation secondary to gluten deposition. C. Direct toxicity of gluten peptides to enterocytes. D. IgE-mediated allergic reaction to gluten. The correct answer is A. Cell-mediated immune response to deamidated gliadin peptides. Question 98. Which of the following statements accurately describes hypertrophy? A. Hypertrophy results in an increase in the number of cells within an organ. B. Hypertrophy involves the replacement of normal cells with fibrous tissue. C. Hypertrophy typically results in cell death. D. Hypertrophy invariably increases the size of the organ. The correct answer is D. Hypertrophy invariably increases the size of the organ. Question 99. Which of the following is the underlying cause of type 2 diabetes mellitus? A. Excessive production of insulin by the pancreas. B. Autoimmune destruction of pancreatic beta cells. C. Resistance to insulin. D. Sudden onset of hyperglycemia in childhood. The correct answer is C. Resistance to insulin. Question 100. A middle-aged adult patient with a recent diagnosis of pneumonia was discharged from the family practice clinic 2 days ago. He now returns with a high fever, elevated white blood cell count, and severe respiratory distress. The patient complains of confusion and is found to have hypotension. Chest X-ray reveals bilateral infiltrates, and arterial blood gas analysis shows severe hypoxemia. Which of the following lung findings would not be expected? A. Decreased lung compliance. B. Significant VQ imbalance. C. Non-cardiogenic pulmonary edema. D. Intact alveolar walls. The correct answer is D. Intact alveolar walls.